Good morning to all of you here. We have had brainstorming sessions yesterday also. A lot has been said and a lot is still to be said. And looking at the kind of audience here and the distinguished panelists and resources which have come from all over the country, I think it's going to be a very vibrant day today ahead. And I feel that it is not merely uh, an event, but it is a chance to, for cross learning across states, across government systems, private systems, and hand holding each other to achieve the larger objective of health for all, universal health coverage, accessible and affordable health care. Uh, as I told you yesterday, uh, there are two game changers which have come in the last 10 years. That is, number one, the Prime Minister's Jan Arogya Yojana and the Ayushman Bharat digital mission. These two envisage, uh, health financing, which has the roots in the fact that a cross section of people across the country and the larger populace, which is, living with meager incomes, don't find a way into the kind of quality healthcare which they would like to have. And once the PMJY has come into place, a normal household, any individual having any health ailment, a surgical emergency can walk into a hospital, cashless and get procedures done. Then the other aspect is the Ayushman Bharat digital mission. I personally believe it's paving a way for a very transparent, accountable, and seamless way of delivering healthcare. The digital imprint, as we all know, has already taken over all our spheres of our life, including the UPI payments, the banking, the ticketing of air ticketing, trains, everything. Probably now the consumer has to also pay online for his electricity bills. So, healthcare per se now, uh, the digital, presence of healthcare is going to make a large impact. Number one, a huge repository of health records is going to build up. In the coming times, you will see that this repository, as yesterday we were saying AI, if we have AI, we need data. And we are having metadata right now. But as you all know, the data is in silos. Suppose in databases in hospitals spread across the length and breadth of the country. But this data needs to be consolidated. This data needs to be put into an interoperable platform where this data can become useful. If you have an algorithm of CT scans, for example, and you develop a AI, platform from a particular group of data where you have, say, you have got it from the state of Chhattisgarh. Uh, the prevalence of disease in Jammu and Kashmir and Rajasthan are different. West Bengal are different. Maharashtra is different. So, pooling of this entire data and forming the needed algorithm for the AI based application would be much more effective if we have this entire information in that consolidated and interoperable form. And I think the need of the hour will be to integrate and convert our digital public infrastructure. That will become a key also to integrating our health services on the digital platform with many other services. Wherever you go in the hospital, you have an Abha number right now. You have the Ayushman Bharat health account. That's a unique health account you all will generate. But the need would be in future to link it with your Aadhaar card. It is already linked. It should be linked with the transport license which you have, the bank account you have. It needs to be made into a larger social security number, maybe, which is unique, so that DPIs could become more viable and more strong across different sectors, government and private. So having said that, there is a day ahead. There are a lot of great experts sitting in the audience. I think more are expected. The day is going to be fruitful, informative for all of us, and I always think there is a scope to ask questions from the audience, from the experts who are going to sit here. I think we should go. The takeaway should be that we should be able to brainstorm to a level that we can carry this digital innovation and the digital wave into transform it into a logical ending, and which should benefit the patient, the healthcare provider, and all the stakeholders who are there. Thank you very much, everyone, for your presence here. We'll have a session also later where I'll also be present. I will magnify my understanding of e-health more on that session. Till then, thank you very much, all of you. Thank you.